The Kardashian Wests are thinking of expanding their clan, but could a third baby actually kill Kim Kardashian? Dr. Anita, you're an OB/GYN. There's a reason why we're talking about this story, because she does have some risk factors.
Yeah, absolutely. So what Kim experienced is called a placenta accreta. And basically, the placenta carries the oxygen and nutrients to the baby during a pregnancy. So normally, the placenta attaches to the uterine wall, and after delivery, the placenta will detach so that the uterus can contract and contract around all the blood vessels to prevent a postpartum hemorrhage. Well, in Kim Kardashian's case, the placenta attached too deeply into the wall. So after delivery, the placenta couldn't detach, and therefore the uterus didn't know to contract down, and in those particular cases you can get a lot of bleeding. And just to give you a perspective, the average blood loss is about 3 to 5 liters in these deliveries.
So that is a life-threatening
it's a real thing. Yes, it is life-threatening. It is serious.
So in a case like that, you type and cross them, have them prepared.
Oh, in a case like this, ideally everybody knows. Like, people know in the hospital. It's not a secret. The anesthesiologist knows. Sometimes you'll have an oncologist on board just in case you have to do an operation. They're like, sometimes these women have to have a hysterectomy at the time of delivery.
Wow, so they have to be considered.
This is also why we often talk, because leading cause of maternal mortality, this is why you also talk about, no matter how you decide to deliver your baby, just make sure you're aware of certain risks, because these hemorrhages can be so robust and so quickly. And it's interesting, the mortality rate, when you look at these women, it's more common if they're in an area, right, like a rural community where maybe they don't have all hands on deck as a capability. Is that true?
It can be dangerous in those cases. So in those particular situations, those hospitals, they do their best, and they do a great job of caring for women. But in some cases, if they're not able to get one of those detailed ultrasounds, then they're not able to identify the problem early on, which is ideal, because you don't want that surprise at delivery.
So how does, Dr. Anita, how would you, what advice do you have for Kim? I mean, is this a strong enough reason not to carry a third child? Should she consider a surrogate? I mean...
Absolutely. So a couple of doctors actually said that she should consider surrogacy. And as a board-certified OB/GYN, I would say it's a big risk, and I would not recommend taking that risk. I think surrogacy is a great way to go for her.
All right.
That could be a reality show. Who will be the surrogate?
Dun, dun, dun.
Well, and it also highlights one of the blessings nowadays. We talk about prenatal care, known risk factors, and we live in a blessed time where she can mitigate risk factors, and certainly will keep everyone abreast of what happens in this particular scenario.